Assalamualaikum warahmatullahi wabarakatuh. I bid to Madam Zulina. Our group are going to present SDG 3, Good Health and Wellbeing. Social distancing hinders the widespread of Covid-19 virus in Malaysia. Our group consists of 5 people, which is me, Fatin Kimila binti Ibni Hajar, Dayana binti Muhammad Hasnul, Sharifah Ain Sabrina binti Said Rusli, Nur Hashadina binti Khairuddin, and Muhammad Irfan bin Fairuz.
So our research is aligned with the third SDG, which is the good health and well-being, and our title is Social Distancing Hinders the Widespread of Covid-19 virus in Malaysia.
The purpose of this research is to study about the effectiveness of social distancing measures that are being applied in Malaysia to hinder the widespread of COVID-19 among every individuals. The findings from this study indicates that the implementation of social distancing is very beneficial, as most of the respondents agree with the significance of social distancing. The next one is the respondents also have a sufficient knowledge about this issue, and they also believe that social distancing helped to limit the spread of the virus. Lastly, the contribution of this study is to prove the effectiveness of social distancing during this pandemic and to control the new daily cases in Malaysia.
WHO has announced this COVID-19 virus as a public health emergency, where there are 37 million people have been affected with this virus and more than 1 million deaths has been reported. This virus first came from Wuhan, China on 31st December 2019 and has begun to spread globally, with the United States having the largest amount of cases recorded and the Italy having the highest amount of deaths. Even though COVID-19 symptoms are comparatively mild with no serious consequences, the modeling data indicates that approximately 4% of the worldwide population has the possibility of getting the serious infection of COVID-19 that requires a hospitalization for recovery. This virus is highly infectious and transmitted from a person-to-person contact. According to a research, the COVID-19 patients were seen of having symptoms such as fever, coughing, and shortness of breath. This virus is transmitted through a respiratory droplets when the diagnosed person coughs or sneezes. And the main causes of this infection are from coughing, sneezing, and by touching contaminated surfaces. The severity of this disease varies, and it often affecting individuals who have low immune systems and the elderly. Public health movement has been tasked to establish the behavior-based strategies to encourage the practice of social distancing within the community. Given that social distancing is an unusual activity in most countries, it is important for us to recognize the determinant of social distancing activity. Several countries, including the UK, the US, and other European countries, are adopting to these social distancing measures. As of May 2020, social distancing is recommended as one of the strategies to slow down the spread of the COVID-19 virus. In general, social distancing means maintaining a safe space which is approximately 1.83 meter apart between another individuals that are not from the same household, and limiting the amount of times when individuals comes in contact with one another. By doing this way, the spread of COVID-19 virus can be avoided. Finally, this study is crucial because we want to spread the awareness on how important social distancing is during times like this. And the goal of social distancing is to ease the healthcare system's demand while the pandemic is at its peak, so that the healthcare workers can deliver the necessary treatment to those who need it the most.
Our problem statement, the first problem statement in this study is that currently there is no specific treatment or vaccines that has been approved for use in humans. Therefore, it is important for netizens to have their own initiative and willingness to break the chain of this virus. Second one is, we are not done in flattening the curve. Since the beginning of this pandemic, we all know that flattening the curve is important, and to achieve this, social distancing is the key of it. However, a flat curve will not stay flat unless everyone is committed to the steps and precautions that have taken us there in the first place. Therefore, it is important for our community to social distance themselves to keep the curve flat, which can ensure our business remains safe as well as to maintain our health. The next one is this virus can spread from people to people. It can actually make an infected individual transmit this virus to anyone nearby. And it is also important to know that an individual can transmit to at least 2 to 3 individuals on an average. The last one is we can spread the virus without knowing it. In fact, a person can be affected as early as 3 days before symptoms begin to show. And in some cases, an individual never develop any symptoms but are still capable in transmitting the virus.
Our research questions are: can we prove the effectiveness of social distancing by observing and interpreting the number of cases recorded? Next, is the impact of social distancing on coronavirus effective enough to prevent the spread of COVID-19 virus in Malaysia? And the last one is, social distancing methods have been applied since SARS and French flu era. Is this method still applicable to this mutagenic and new form of COVID-19 virus? Our objectives are to investigate the methods to hinder the widespread of COVID-19 virus in Malaysia, such as social distancing, by observing the number of cases recorded in Malaysia during the first wave and the second wave. Next, to prove that social distancing is the most effective way in controlling and preventing the spread of COVID-19 virus in Malaysia. And the last one is to prove that the usage of social distancing during the presence of previous diseases such as SARS and French flu is effective and convenient to control the spread of virus nowadays. The hypotheses that we will be implementing in doing our research are: number one, if strong social distancing is strictly implemented, the spreading of COVID-19 virus will decrease between an individual. The next one is, if the occurrence of the social distancing in Malaysia is being controlled, a high reduction in the growth rate of the virus can be obtained. And the last one is, if more social distancing method is being conducted in Malaysia, a lower rate of people being infected with COVID-19 can be achieved.
What is significance of study? Significance of study is the important topics highlighted in this project. There are several topics for this project. First, carrying out this research to study the relationship between the effects of social distancing to prevent the widespread of COVID-19 virus. Second, this project focused on SDG number 3, that is good health and well-being, and its components. Third, social distancing is a non-medical physical method that is used to prevent airborne virus from spreading, and it also adds physical distance between people. One of our methods that we use for collecting data is by distributing online questionnaire throughout the nation to gather their opinion regarding social distancing. Moving on to literature review. First, social distancing is a method used by other states such as China, Indonesia, and Korea. Social distancing has been proven by many scholars, as you can see here. Matt et al., Fang et al. Has proven social distancing is a method in hindering airborne spread viruses. Social distancing is a method that has been implemented during the 1990s. For example, in 1918, social distancing has been implemented in Spanish flu influenza pandemic. During 2003, social distancing also used in SARS flu. Next, alternative methods to further reinforce the public to encourage social distancing, such as enclosure of malls, restaurants and clubs, wearing face masks, and practicing proper hygiene. Social distancing helps medical workers to control and lowering the amount of people infected. Social distancing encourages isolation between the sick and the health and the sick. Third, social distancing helps to lower and flatten the pandemic curve so that all medical supplies are enough to encounter and withstand the amount of infected patients in that particular hospital. We have used this online questionnaire method as it is the most suitable method in gathering data, especially during a pandemic where face-to-face interaction is prohibited. This method can be easily distributed to many people via email and other social media communication platforms, so this is the gathering methods.
With the question, do you practice social distancing at your area? We get 3.579 mean, which is located at the third scale of our list. Therefore, the respondent believe that social distancing can decrease the spread of COVID-19 between an individual. The first mean from our table 2 is 2.789, which is located at second of our scale. Same goes to second question, which is, do you notice drastic changes on number of cases recorded? What we can say that the respondent believe social distancing is controlled and can reduce a high reduction in growth rate of the virus. The first mean for table 3 is 4.281, which is located at the fourth place of our scale, and same goes to the second question and the third questions. What we can say from our mean is, if more social distancing method is conducted in Malaysia, so lower rates of people infected by COVID-19 can be achieved. If the F ratio is less than the F distributions, we can say that the hypothesis is accepted. If the F ratio is more than F distribution, the hypothesis is rejected. From our research, we get that the F ratio is 0.46, and the F distributions from the F distribution table is 2.12. But we can say that our hypothesis is accepted because of the F ratio is less than the F distribution. The limitation that we get from our research is, our research performed on a small population. Second, dishonest answer from respondents. Third, our question does not capture an emotional from our respondents. The fourth point is, finding can be inaccurate because of every region have different daily cases report. The fifth one is social distancing implementations are different according to different district area. Discussion that we can conclude in our method is, various efforts and regulation have been further introduced by the government to public, such as early closure of malls, movement control order, street gathering policies. Next is, one of the ways that can further implement social distancing is by educating in schools, malls and gathering events. As we can see, the government strictly disencourage people to make a wedding or anything big event during PKP. Next is, strict social distancing implementations can be seen when the government issues strict rules regarding states' border crossing, international flights between countries.
As COVID-19 emerged as a global threat in early 2020, a rapid research was conducted on the effectiveness of social distancing in Malaysia. The research projections indicate that without comprehensive social distancing measures, the emerging outbreak will exponentially exceed healthcare industry ability. However, with strong social distancing, the number of cases, death and hospitalizations can be considerably decreased throughout the whole year of 2020. Although these analyses are only consists of 57 respondents, we expect that the impact of the mitigation effectiveness will be qualitatively similar across Malaysia. The result estimates revealed that the number of COVID-19 infections decreased with respect to implementing social distancing. Our results also appear to be practically consequential that at least in Malaysia, the implementation of social distancing would substantially decrease the infection between an individual. Last but not least, the understanding of COVID-19 virus is evolving so vigorously that it is proven that a lower rate of people infected by COVID-19 can be achieved when more social distancing method is being conducted in Malaysia. So as these findings clearly demonstrate, individuals must implement social distancing strictly in their daily routines, which can be related with our SDG 3 that aims to encourage healthy lives and well-being for all ages. As we commit ourselves to obey the rules, progress in biomedical research still continues to combat the COVID-19 virus. The vaccine of the virus is yet to be found until the time of this research is being conducted. Hence, social distancing remains one of the strongest weapons in slowing down the propagation of the transmission of COVID-19 virus. Importantly, it is the whole nation who needs to take part in saving ourselves from this COVID-19. Therefore, it is best for all to play our role as an individual to help each other during this COVID-19. With this, social distancing is a must. Thank you.